Have you found yourself stiff and achy in your lower back? Have you tried different exercises and nothing is quite working for you and you want to resolve it? Well, if you've never heard of Pilates, Pilates-based exercise is a proven strategy to help resolve back pain and keep it away for good. It's very effective, and today we're going to get into how Pilates exercise can heal your back pain and prevent back pain from returning. My name is Dr. Dawn Andalone. I'm a women's health physical therapist and also Pilates instructor. And after helping so many women overcome back pain, Pilates-based exercise is my favorite recommendation for an exercise routine and different strategy of how to exercise by using the Pilates principles in order to resolve back pain and keep it away for good. Honestly, it has shown some huge benefits to women that I know we work with one-on-one, and also for my own self overcoming back pain in the past. Pilates exercise is a movement system that helps with poor posture, helps really be able to help your alignment and improve your posture, helps your core strength, helps your overall flexibility, balance, and strength of your entire body. For anyone that sits long periods of time or has been dealing with an injury, there is a Pilates exercise for you, and seeing someone that is going to guide you through some mat exercises or exercises on the Pilates reformers, as you see behind me, can be very effective for helping your back pain resolve. So that's what we're going to get into today, how it can help you. So Pilates focuses a lot on alignment, posture, strength, especially core strength, and really how you hold your posture with some of the exercises has a huge carryover into your daily life. That's why it is so effective. So you're really listening to what your body needs during each exercise by connecting your brain to your muscles, which can't always be done if you're in a gym and doing large muscle group exercises. It really takes a little more focus and control. But in that regard, it can be very helpful for overcoming injuries and helping your posture and your back pain long term. One of the main principles of Pilates is really helping build your body's foundation from your midsection, which is so important for that carryover into your daily life and some of the things that trigger back pain. If you're working on building this foundation around your midsection, your pelvis, your lower back, and your abdominals, therefore, your back is going to respond better to daily activities or periods of time where you have to sit in the car or sit at a desk. Your body is going to be more supported and therefore not put all the stress on your spine. You're going to be working on your pelvic muscles, your abdominals, and your back, like I mentioned, in order to take the stress off your spine and alleviate some of those normal aches and pains that you would get that puts pressure on the discs in your back and also those ligaments and other areas around your spine that need more support. When your body is more aligned and stronger, it's going to take less strain off of your back. So I want to take you through a few simple Pilates mat exercises to really showcase some of the foundation of what we're cueing and what Pilates exercise can really help with that midsection. And these 4 exercises, practicing these on a daily basis can really do a lot for your posture and alignment, and allowing you to carry yourself a little bit differently when you are sitting or standing. And therefore, over time, your back will get used to this and it will have less pressure on the areas that are more painful. Okay, here I'm going to take you through a few of my favorite Pilates exercises, just starting from the beginning. And these are simple mat exercises you can do on your own at home with a mat on the floor or up on your bed too. So we're going to start on our back, and we're going to have our legs up in a 90-degree position. So 90 degrees from your shins to your femur here, my thigh bone. And I am in this position here, but I don't want to let my ribs flare up toward the ceiling. I'm going to just draw those muscles in through my abdominals a little bit, just enough to hold my legs up. And you don't want to grip so much through your abs. You want to be able to still breathe freely. So from here, I'm in a 90-degree position, and I'm slowly going to lower down one leg at a time. And doing Pilates mat exercises, you are using your own body weight. The reformer is fun because you can have springs and resistance against, so it can assist you for some exercises, and also others make them more challenging. But we're just alternating back and forth. Inhale as your leg comes up, exhale as you lower slowly. And as we drop that leg, you're gonna feel like you have to use your core and use your abdominals a little bit more. So that is legs in 90-90. If that is bothering your back, you can just start with a march, one leg at a time, and think of engaging the core every time your leg lowers. So you're doing this thinking about those muscles pulling in, drawing in, but not tensing your back at the same time. That can be a modification if your back is hurting right now. But this exercise will strengthen all these muscles around your midsection. So that is the first exercise. The second exercise is a bridge. So on your back with your knees bent, we are going to draw the navel in and squeeze through your glute muscles, and we're going to lift up into that bridge. So you feel some tension in your lower back and through your hips and your hamstrings. And just pause at the top for a second or two. And you're engaging all those muscles like a corset around your spine and around your midsection. So I'm going to repeat that about 10 times doing the bridge exercise. Next is a roll up. This can be a little more challenging. There are ways to use a band around your feet to slow it down and also do it in a more modified version. I am going to show how we teach it in a Pilates mat class first, and then from there a modification. So we have our arms in front. Take an inhale. You're sitting up nice and tall, getting that length in your spine. And then you're going to slowly, as you exhale, roll down one vertebrae at a time. Then at the bottom, you see how I have my knees bent? That's a modification, makes it a little bit easier. Inhale at the bottom, and then exhale. Tuck your chin toward your chest. Use those abs and roll back up slowly until you're sitting up. Now, if that's really hard for you, you might just want to go a modified version. So down to here, and then use your core to pull you back up. Not hinging at your back, but use those muscles from your midsection to lower you down slowly and also to pull you back up. You can do 5 to 10 of those, working into a full roll up and roll down with your legs out straight for a more advanced version too. Now the next one's a spine twist. So as you can see, I have my legs apart, and I'm gonna get up nice and tall through my spine. So think of someone pulling you up from the top of your head, getting that length in the torso. And then from here, you can just take your feet apart or your legs apart a little bit. From here, I'm over my sits bones. I'm gonna stay up tall, and I'm gonna exhale and rotate my upper back and come back to the center. Use those muscles from here to twist. Inhale and exhale and twist. Inhale, exhale, twist. Now you're actively using those muscles in rotation, but once again, if that's painful, just limit your range of motion or go back to one of the first 3 exercises and repeat that again too. That may be too much on your back if it's too much too soon. Now, these 4 exercises can be done on a daily basis to start integrating Pilates into your daily routine. So therefore, you want to warm up and walk or do something where your muscles are a little bit warm before you get into the sequence. But this is a great way to start teaching your core muscles how to activate when you go to bend and move and do things throughout the day. It really has that great carryover. Those are just some basics of Pilates. There are thousands and thousands of really fun, creative exercises that you can do, especially on the equipment or also more on the mat too, with props like a ball or foam roller or other types of tools that you can use to make the exercises more unique. Now, with all the benefits of Pilates, I find that if you're working through any exercise and it doesn't feel quite right, then you definitely want to stop and not push yourself. Back pain can be something that your body has to get used to, these new ways of moving before you get over that hump. So getting on a daily routine of things that are feeling strong and supported for your back, and gentle movement first, and then gradually pushing it a little bit more. But having a Pilates routine, you're going to see a huge difference in how your core muscles activate and how your body is carried over into your posture in your daily life if you're doing Pilates 2 to 3 times a week over a series of at least 6 to 8 weeks. It is pretty amazing in helping heal back pain for long-term relief. So I hope you found this video helpful. I have other videos all about Pilates-based exercise, especially for back pain on this channel. Go back and watch those. And if you haven't subscribed, please do. I release new videos every week, and I'd love to teach you more about Pilates and how it can help you. Thanks so much for watching, and we'll see you in another video.